If I had a hip replacement and need a knee replacement soon too, as I walk, as exercise to strengthen my surgical hip, am I making my knee worse? And then the bad knee is the opposite leg, is bone on bone, and it hurts. Okay, so if you had a hip replacement and the knee is scheduled to be done soon, and so you're walking, you're trying to strengthen your hip, and you want to know if you're making your knee worse. The answer is probably not. So if you have a bad knee, it's certainly not going to get better in terms of what's going on. The arthritis isn't going to miraculously improve with a hip replacement, but you have to focus on the hip that was operated on. And so during the rehab process, we oftentimes hear that, other joints start to hurt. And I think that there's sort of a progression to this. So initially, as you're recovering from a joint replacement, whether it's a knee or a hip, if you have arthritis in another joint, you may experience an increase in pain because you're compensating for the joint that's recovering. As that recovery progresses, and this is usually in the course of a few weeks, you're going to get stronger, you're going to get your motion back, and you're going to be able to offload the weight onto the new joint. And it's going to be hopefully comfortable, and you'll have good function. And as the strength improves, you're going to get back to normal functionality in the new hip or the new knee. And when that happens, it's going to have the opposite effect, usually, on the joint that's still got bad arthritis. And what I mean by that is to say that as you can start offloading the bad joint onto your new joint, there's a sort of paradoxical improvement in pain oftentimes. But that being said, if you're experiencing increased pain, walking and doing the exercises is not going to inherently change anything that you need to do surgically on the joint that's getting replaced second. It's fundamentally not going to change what we do. So you just need to be in tune with your body and understand what your limits are and not push yourself too hard, but push yourself enough to adequately recover from the first joint before considering the second joint.